Today, Great.com talks with Josh Green, who is the operations director of the food bank for Larimer County in Colorado. If you haven't heard of them, their mission is to provide food to all in need through community partnerships and hunger relief programs. If you're new here to this podcast, press subscribe on YouTube or in your podcast app, because today we learn about how a community can help to reduce food insecurity. Hi, Josh. Welcome to our podcast.
Hello. Thanks for having me.
Our pleasure. To begin our conversation, I would like to understand more the situation at Larimer County right now. Can you fill us in, please?
Sure. So Larimer County is located in the northern part of Colorado, about an hour north of Denver. And over the last 15 or 20 years, we've seen a huge growth in population, and specifically affluent population, which has gentrified a lot of areas of our county, raising housing prices. We've also seen a big growth in tech industry up here, which has increased the number of high-paying jobs, which has increased the number of high-cost houses as a result. So cost of living is relatively high here, and that doesn't bode well for a lot of the citizens who have been here for a long time, have generations of family here, especially minority populations, often struggle to make ends meet. And so we have been in existence for 34 years, since long before a lot of that growth happened. And our goal has always been to feed people, to provide food to anyone who needs it, just like our mission says. And that has become really front and center over the last really 10 to 15 years, as we've seen the cost of living increase exponentially without a corresponding increase in all wages. So that's kind of our situation. Larimer County is relatively small. There's two main population centers, Fort Collins and Loveland. And the population centers are really where the majority of the population is focused, obviously. We do have some rural, some mountain communities, and we serve those through agency partners who are other food pantries, other nonprofits doing hunger relief work. So we do have a very good reach throughout the entire county. And we have a physical presence as our specific organization in Fort Collins and Loveland to meet that need. So.
Oh, that's awesome. Yeah, I saw that you had 3 locations on your website, and I thought, okay, this is really a huge system, right?
Yeah.
That's great.
Yeah, absolutely.
And how does your help work exactly? How do you make the connections from the donors to who is in need?
Yeah, that's a great question. So we have kind of 4 main areas of work. Our first and biggest is client choice pantries. So these are food pantries where anyone can come shop. We have income guidelines, but they are just that. They are guidelines because we recognize that sometimes even individuals, families that have a higher income on paper are facing economic insecurity, food insecurity, and need help from time to time. So those pantries are open to the public. And as I stated, they're client choice. So that means people come in, they pick their own food. It operates much like a grocery store, except that we check them in at the beginning to get their information for grant reporting and things like that. And then they don't check out at the end. So it's all completely free of charge. And they're receiving many things that you'd see in a normal grocery store at those pantries. We have a very similar model that is a mobile version of that. So they're mobile pantries. So those are going into communities specifically on a regular basis, where those communities and really anyone else can come shop as well. We try to fill out our hours of operation with those mobile pantries. So those operate in the evenings and on the weekends. Our main pantries that are actual buildings in Fort Collins and Loveland are operating Tuesday through Saturday. So during the day. So we try to get a good broad spread there so we are as accessible as possible. Our second channel is through agency partners, like I mentioned before. And these are partners that range from congregate meal services. So, meals prepared that people come and eat, whether they are currently unhoused or they are in an addiction recovery program, things like that. Some of them are safe houses. Some of them are after school programs. Some of them are pantries, much like ourselves. So it really runs the gamut there. So these agency partners can come to our main facility and shop for what they need for their programming. And all of that is available to them free of charge as well, which is a change we actually just made relatively recently. Previously, they were helping us to offset the cost of getting the food in. We bring in a lot of food from throughout the country, and so we're paying $5,000 or $6,000 per truckload of this food just to ship it from California or New York or Florida, because Colorado is not a major production state for manufactured goods, and also not a huge producer of vegetable and fruit crops either. So we're bringing in product from all over the country, and that has a cost. But fortunately, over the last 2 years, with the community support we've received throughout the COVID pandemic, we've been able to actually eliminate those fees permanently. So that's really, really cool. So we're now able to provide that food to our agency partners free of charge, which in turn enables them to grow more rapidly and meet the need that they're seeing in their individual communities. The third kind of area of work is our community kitchen, which is a full service commercial kitchen that prepares meals and snacks for students and seniors. So we are partnering with school districts to provide meals during the summer when kids are not in school and then have an increased level of food insecurity. We're also providing meals and snacks to after school programs, some before school programs, things like that. And then our fourth is more of an outreach area, and that's relatively new in the last 5 years. What that involves is SNAP outreach. SNAP is the same as food stamps. So we're actually helping individuals and families get enrolled in that program. We have a bilingual team of English and Spanish speakers that are doing active outreach to get people enrolled in that, because that's a huge, both a help for the families, and also it puts dollars back into our local economy as well. So we have that. And then another area is Cooking Matters, which is like nutrition education aimed at young families. So teaching them how to cook healthier meals for their families, because a lot of people have never learned how to cook even very, very simple meals. So that's focused on, single burner meals that can be prepared very quickly, very easily for families where both parents are working 2 or 3 jobs and they don't have much time. So trying to empower people to, cook for themselves, eat healthier, stop eating fast food, things like that. And then in addition to the SNAP outreach, that team is also doing service referrals for other services in the community and things like that.
Wow, thank you. You gave me such a clean and big idea of the whole process. I wasn't aware of, well, especially when you said that about the specificities of the Colorado state, that you don't produce much things. I had no idea about that. And usually when we think, okay, that shouldn't count, there's food, people are going to donate the food. So yeah,
right.
That's incredible. Wow. And you talked about the SNAP, right? So yeah. And I saw that you had a SNAP challenge on your website. What is that?
That is not under my direct purview, but we're always trying to incentivize SNAP enrollment. So Larimer County has historically had a very low SNAP enrollment rate, and that could be any number of reasons. SNAP, EBT, food stamps, whatever you want to call it, has been stigmatized for a long time. Paying with a SNAP card or using a SNAP voucher in a grocery store is not always looked upon favorably, which is unfortunate because it's a really great way to leverage government support to support individual families. And there's in spite of the stigma, there's a much higher level of dignity in being able to shop for and choose your own food at a normal grocery store instead of having to go to a food pantry. We do our best to make our food pantries as dignified and as destigmatized as possible, but it's still a separate trip. And if you are low on gas or you have to get your kids from school right after work, it's difficult to make an extra trip, right? So SNAP is a really great way to do that. And so what we're trying to do is destigmatize SNAP a little bit, make it something that is more engaging and incentivize people to at least enroll and try it so they can see for themselves how very easy it is and how transparent it is to anyone who might be standing by. So SNAP now works with a card that is preloaded each month with a certain dollar amount. So you can pay at any register just like you would with a credit card or debit card. So it's very, very easy. So that's really what that's all about, is just getting people to enroll and give it a shot.
Amazing. I loved it. And I love the fact that you're trying to also stigmatize that, because it does sound like something that could be more of an issue than just the physical one, right? It has something to do with mental health as well.
Absolutely.
Also, I saw another thing on your website that I thought was very clever. There was the Nappy Project, right? It's
Yeah.
like extending it from going beyond food, right?
Absolutely.
What is it?
So the Nappy Project is something that was started by a volunteer of ours several years back, actually. She was volunteering in our Loveland pantry. She was seeing the need for essential items for families, but specifically for diapers. Diaper need is not something that's talked about nearly on the scale of food insecurity. And diaper need is really, is a very tragic outcome of poverty, where parents will use diapers 2 or 3 times on a child, or you reuse a wet diaper because it's not soiled in the same way. And obviously this is very, from a health perspective, very harmful for the child. But parents sometimes don't feel like they have another option. And so she saw this and she started to research about it, and she decided that something needed to be done. So her name is Jan Tousley, and she decided to kind of rally and start raising funds and gathering donated diapers, which she then, with her kind of team of volunteers, began to repack and then distribute at the food shares. And over the years, this grew and grew and grew until she was serving another 40 partners with these diapers. And just very recently, in the last year, she crossed her millionth diaper mark distributed, which is really amazing. And also in the same year, she approached us and said, hey, I would really like to, she's retired. This is her retirement project, and it was taking so much of her time. And she also wanted to see it grow. And so with our infrastructure and our team and our community support, she said, hey, I think this is a really good fit for you all to take on. Diaper distribution is not something that food banks have done a lot of in the past. And she said that she didn't think that mattered, and that we should be some of, and we said, yes, absolutely, let's do it. And so as of July, this last July, we took over the Nappy Project from her, and she was able to transition out and kind of return to being a volunteer with us rather than running her own organization. And it has been really, really cool to take that project on. Not much has changed since us taking it over from how it was, because we're still distributing diapers through both our pantries. All of her existing partnerships we're continuing on. But it's fortunate timing in that the state of Colorado just authorized a large portion of funding, millions of dollars specifically, to provide to diaper distribution agencies in the state. And so we were able to apply for and receive around $130,000 from that grant to purchase diapers, which will allow us to really meet the need more effectively, and hopefully in the future expand a little bit to serve even more partners, therefore more families.
That's beautiful. Truly is something that people forget, right? Because poverty is not just about feeling hungry, but also about health issues, right? So
absolutely. And diapers are so expensive.
Yes, absolutely.
There's, they're so disposable diapers are expensive, cloth diapers are expensive and time consuming. And if there's one thing that people have less of in poverty than money, it's time. And so all of the arguments that, say people should be able to do it are really irrelevant when it comes to diapers. It's you have the time and the money to diaper well, or you don't. And it's, nobody's fault necessarily. So it's good to be able to distribute those because, the other thing is we aim to be a supplemental resource, right? Like we can't physically or financially provide everyone's entire groceries for the week or the month. But every way that we can find to offset their financial requirement for the month frees up dollars for them to put into other things, such as childcare or the heating bill or their rent. or other food products that they can't get from us. And so diapers was another really effective way for us to do that.
Awesome. Now, moving on a bit about how people can interact with you. So if I know someone that is in food insecurity situation, or maybe I can make a donation to you guys, for both cases, what is the best way to get in touch with you?
Yeah, so there are a lot of ways. The best way is through our website, because that has information on all of our services and all of the places that people can come. Folks are also welcome to come into any of our pantries during our open hours, or we have a phone number that people can call that goes to just our front desk, and our receptionist can then help guide people toward the services they need, recognizing that some people, in spite of the times, don't have internet access for whatever reason. And so, so really our website or our phone number, or walking into one of our locations.
Awesome. And to really make a big impact to your efforts, what is the best way to help? What is the best way to donate?
Yeah, the best way to help right now is actually with time. We have, I never want to discourage people from financial giving, because that is necessary for us to continue operating. Where we see the most need right now is with volunteer hours. One of the unexpected impacts of the pandemic has been, and especially with the increase in concerns over the Delta variant, one of the biggest challenges we see right now is filling our volunteer slots. We have around 60 full-time staff that comprise our organization, and we have thousands of volunteers on top of that. Our volunteers every year end up accounting for around the hours equivalent of 20 more staff. And so without them, we really couldn't do what we do. And as of late, we've seen a lot of concern over, being in person, volunteering and all of that. And that's very understandable. But that is definitely where our need is the most.
Great. So people go there. Please help out.
To come and help us. Yeah. And it's a great experience. It's a very powerful, very fulfilling experience to engage with our clients, to help us in the work that we're doing, to meet our staff and, learn why that they're excited about the work they do. And to me, it's, it requires more, right? It requires actual time and actual presence, but the rewards are phenomenally worth it.
Yeah, but I think it must create a sense of a stronger community as well, right? Like feeling people that actually live around you working together.
Absolutely. Yeah. And I think that that's something that we all need right now. Yeah. A lot is to feel like we are a part of something and not just isolated in our homes.
Absolutely. Well, talking about COVID just a little bit, did you see a growth on the number of people in need during those times?
That's a great question. Yes. I mean, the short answer is yes. So the number of pounds that our agencies were taking doubled almost immediately, and it has stayed at that place. So our agency partners have seen a drastically increased need. We have seen our needs stay about the same. And there are a couple of reasons for that. So prior to the pandemic, and as a result of our position in the community, we had a very high saturation of our service area. So we serve all of Larimer County, and we were serving a lot of the people that needed us already, which is really, really great. Prior to the pandemic, we were serving the vast majority of people who needed us, according to our numbers kind of superimposed over United States Census data. So the surveys that were done on need in our county overlapped really, really nicely with the work that we were already doing. When the pandemic happened, there was an enormous amount of government support that arose seemingly out of nowhere. And this has had far-reaching impacts beyond hunger. The government support, the now year plus of really favorable unemployment benefits available to anyone who wants to apply for them, has impacted the labor market. So we actually saw an increase in support outside of our organization for the people we were serving, which made it less necessary to rely on our services. Now that we're seeing some of those support systems fall off or cease, we're seeing those numbers actually begin to increase. And my kind of assumption, or my educated guess, is that as we begin to see the long lasting impacts of the pandemic on the local and the national economy here, we will see the need for our services increase now rather than during the pandemic. Because there's, it will create a vacuum of support. And that is when people will really need to rely on us even more heavily. So we're starting to see those numbers pick up. I would anticipate that through the holiday season, we'll see them rise, and then I don't think that they'll go back down in January, unfortunately.
Wow. I think your reasoning makes lots of sense. And well, unfortunately, this pandemic has had many downsides, right? Not just on our health, but I think in a global scale even.
Yeah, absolutely.
Yeah. Well, I have to cut short our talk here, but this has been a wonderful, great talk. Thank you so much, Josh, for joining us today.
Absolutely. Thank you for having me.
Again, our pleasure. And to you listening in there in your home, thank you again. And if you enjoyed this episode, please press subscribe on YouTube or in your podcast app, because that will show the algorithms that this is an important conversation, so more people can learn about the importance of the food bank for Larimer County. See you in the next episode.